I know there's some new faces, so if you don't already know me, I'm Dr. Megan Dowling, and I'm a 5th generation doctor of chiropractic. My family's been practicing chiropractic in San Jose for over 100 years. And in addition to doing chiropractic adjustments, we also do a lot of nutrition in our practice. The foundational philosophy of chiropractic is based on, come on in. The foundational philosophies of chiropractic is based on prevention and wellness, and nutrition plays a big role in all of that, and our education reflects that in school. So today we're going to be talking about the role that inflammation plays on your overall health, and this concept has been recognized for a while now. This article was published in Time magazine in 2004. About how inflammation plays a negative role in your health, but not a lot of discussion has been made about how big of an epidemic this actually is in our society and what you can do about it. Specifically, we're going to talk about what you can do about it in terms of the 28 Days to Health program. So just for a little foundational knowledge, we're going to talk about what is inflammation. It's your body's normal response to injury or irritation, and there are two types: acute inflammation versus chronic inflammation. And we're all pretty familiar with acute inflammation. We've all experienced maybe a sprained ankle. It's characterized by redness, swelling, heat, and pain. And this is a very important process because it clears out pathogens or germs, and it starts to initiate the healing process by bringing white blood cells into the injured area. So without acute inflammation, we wouldn't survive in this world. It's an essential process. Chronic inflammation, on the other hand, is a whole different animal. Basically, it's defined as a pro-inflammatory response of prolonged duration, which is provoked by persistence of the causative stimulus. So, in other words, whatever is irritating the tissue isn't going away, which just leads to more irritation. And the problem is that we really can't recognize chronic inflammation as easily as we can see and feel acute inflammation. So we don't really realize that there's a problem going on until a full-blown disease has manifested itself. A really good example of that is cardiovascular disease, heart disease. Oh, that's okay. And so what happens here is that the first and most common sign of heart disease is sudden death by heart attack. But the actual problem has been likely going on for quite some time. So in reality, no matter which organ of the body is affected, chronic inflammation will have devastating results in the long term. So, inflammation turns out to be the real cause behind many different conditions. So if you look at it this way, cancer has the same foundational cause as something like arthritis. And these are really just symptoms of this one problem here. It really doesn't even turn out to matter the name of the disease. So we know that cardiovascular disease isn't caused by a lack of a statin drug, just like arthritis isn't caused by a lack of ibuprofen. Okay, research shows that low-grade chronic inflammation is responsible for 85 to 90% of all chronic disease. So the good news is that we can modify our inflammatory status utilizing an anti-inflammatory lifestyle. So let's take a peek into how inflammation causes problems. And we're going to pretend like your immune system is a team of firefighters. The top and #1 priority is to protect against potentially damaging threats or fires. So there are also times when the immune system and firefighters are relatively relaxed, performing normal repair and maintenance jobs like washing the fire trucks or working out, sleeping, or eating. So your firefighters and your immune system fight really very hard when it comes to fires. But again, there's also those times when the immune system is relatively relaxed. And so recognize that there is a distinct difference between the infrequent responses to fighting fires or times of acute inflammation, traumatic injury, or illness versus having to battle those fires 24/7. So this is an example of what a healthy immune balance should look like. Your firefighters or your immune system ramp way up for a potential threat here, but when the fire is out, immune activity is supposed to decrease and allow for normal repair and maintenance tasks. So this is normal, and you have to recognize that it's important for your immune system to have an on switch so it can fight against threats, but it's also essential that it have an off switch to allow for recovery. Now contrast this to something like chronic systemic inflammation. So in the case here, your firefighters are exhausted from fighting a particularly stressful and demanding fire, but now instead of being able to come into normal repair and maintenance, they are told that their job parameters have now increased, and they are responsible now for also teaching the city school children and filling potholes and collecting garbage. So as if their original job description wasn't enough, now they have a ton more work to do. And if this was a one-time event, your immune system could probably manage. It would just do the extra work and then catch up on their normal repair and maintenance jobs. But if this were allowed to continue for any length of time, it would cause some serious trouble in the long term. So basically, the bottom line is certain factors, like your food choices, are overwhelming your immune system with too many tasks, then you're going to have problems. Things aren't going to get done, or they're going to be done ineffectively, like healing that stubborn tendonitis, or maybe fighting off that bug that's going around, or even keeping your arteries clear of plaque, which are all very important repair and maintenance jobs that your immune system is responsible for. So I'm going to switch gears and talk about why you need to think about getting healthy today. You need to realize that lifestyle-related disease counts for 8 out of the top 10 causes of death today. So those would be heart disease, cancer, chronic lower respiratory disease, stroke, Alzheimer's disease, diabetes and nephritis, or kidney disease, and influenza pneumonia. So the one thing that all of those things have in common is inflammation. And what's also interesting to note is that the #1 cause of death from unintentional injury is actually death due to pharmacological drugs. So knowing that, you can kind of group this category in with the rest of the lifestyle-related disease, because if the person was healthy, they wouldn't be taking those drugs in the first place. So we also need to realize that our guts are so sick for a number of reasons. And this has important implications because gut health is intricately linked to your risk of developing an autoimmune condition. It's on the rise. It's the #3 killer in the world. And what happens is that autoimmune disease is born within the gut. And that's because 85% of your immune system is actually located within the gut, which makes your guts the biggest and most important immune organ within your body. And your gut and your immune system also relies on those beneficial bacteria that live within the gut and help to create and shape a normal immune system. So if those bacteria are abnormal, which is in the case of most people nowadays, then your immune system isn't going to work right. So there are over 80 different types of autoimmune disease, and what's interesting is that first and foremost, cardiovascular disease or heart disease is actually an autoimmune disease because it's your body's attacking your arterial walls, which leads to inflammation and plaque buildup. So 3 things are absolutely required to develop an autoimmune disease. #1, you have to have a genetic vulnerability to a particular condition. #2, you have to have an environmental trigger. And #3, you have to have intestinal permeability, which is inflammation within the gut. And if your diet resembles anything like a typical American diet, then you have intestinal permeability. So that's why eating the right way, which is how I plan to show you how to eat, will eliminate 2 of these required factors for development of an autoimmune condition. And if you already have one of these conditions, then it will help to reduce your symptoms and help push you into remission. So it's also important to recognize that you really can't afford to be sick nowadays. Every 30 seconds, somebody in America files for bankruptcy due to a health-related condition. And if you're thinking, that can't be me because I have health insurance, you're wrong, because 70% of people who go into debt due to a medical condition had health insurance at the time of diagnosis. So it really would be best to know what some of these conditions might cost you. So this is a hip replacement due to osteoarthritis of the hip, and osteoarthritis is caused by and perpetuated by chronic systemic inflammation. So a hip replacement will cost you about $49,000, and that's not including lost time off work, cost of rehab, and loss of quality of life. And a heart attack will set you back $45,000 to $50,000, not including $850 per day if you should need intensive care, which most people do. And cancer. The average cancer treatment costs $375,000. And that's not including so-called extravagant drugs to help you reduce chemotherapy-induced nausea, which insurance definitely won't pay for, and those cost $100 a pill. So for many people, getting any one of these conditions or other ones means losing their home, losing their life savings, and definitely losing their quality of life, all because of a preventable lifestyle-related disease. And a chiropractor I know says it best when he says, in our youth, we spend our health trying to gain wealth, only to, in our old age, spend all that wealth trying to regain our health. And that's really the norm in our society today. So, also, despite years of our healthcare system pushing a low-fat, low-cholesterol diet, we're still the world's second fattest country. And a little side note here, a lot of people have celebrated the fact that we aren't the world's fattest country anymore.
Who's the
which
first?
is a title that we've held for the last 20 years. But the sad part is that our obesity rates have not decreased. It's that Mexico's rates have exponentially increased. And that probably is our fault in the end. So we really don't deserve a pat on the back quite yet. But the point is that since the 1980s, right here, we were told to eat a low-fat, low-cholesterol diet in response to alarming rates of obesity. And since then, as you can see, this graph has gone up higher than any other country until now. And so obviously the low-fat diet didn't work. And that's what we have to get to the bottom of, are all these dietary myths that just plague our society today. The low-fat diet is one of the biggest, and it's where in these low-fat diet products, they take the fat out, but then they just replace it with sugar. And in the end, it just makes us all fat-soluble, vitamin deficient, which also will increase your susceptibility to all types of chronic disease. So the shocking truth is that fat makes you thin and sugar makes you fat. And so that's one thing we're really going to talk about in the class, are these dietary myths. And we're going to clear them up, and in doing so, we're going to make the sometimes confusing and even contradictory world of nutrition much easier, because basically you're just going to know what's good for you and what's bad for you. And those factors are never going to change. So, also, we should know that people are living longer, but our bodies aren't ready for that type of longevity. So, 100 years ago, people were only expected to live to be 50 years old. So that means 100-year-olds nowadays have outlived their original life expectancy by 50 years. But the sad thing is that their bodies weren't ready for that. They grew up with processed foods, industrial pollutants, lack of fitness, and smoking. And now, typically, they can be found in nursing homes with a severe lack of quality of life. And we really all view nursing homes as places where we don't want to end up in our final years. So we need to take care of our bodies now so we don't have to end up here.
Can we bang back?
So anyway, what is making us so inflamed? What's causing this epidemic? Our food plays a monumental role in this whole thing. Sugar, processed foods, and bad fats are all causing that chronic inflammation within our bodies that eventually just start to break down your organ systems. So the truth is that our foods have a profound impact on our body's inflammatory state. And we really need to get used to the idea that everything you eat will either make you more healthy or less healthy. Those are your options. There's no food neutral or food Switzerland. Every single thing that you put into your mouth will make you either more healthy or less healthy. And the reason for that is that your body makes pro-inflammatory or anti-inflammatory compounds from the building blocks you give to it in the food that you eat. Pro-inflammatory compounds are made obviously to fight infections and to start the acute inflammatory response, whereas anti-inflammatory compounds are made to moderate and turn off the body's inflammatory response, which we learned was a pretty important part of a healthy immune balance. So your body requires a balance of these two compounds in order to remain in an inflammatory neutral state. But today, because of extensive, maybe you can go knock on
She's
the
gonna
door.
come through the wall.
It's the cleaning lady, right?
Take the wall down.
Tearing down the house.
But today, because of extensive food processing, the typical American diet contains over 30 times more pro-inflammatory compounds than it did a century ago. And this, truthfully, makes your body primed for out-of-control inflammatory reactions. So if you get sick or you get injured or maybe even just simple wear and tear can literally start that spark that sets your body on fire. So what specifically is a problem here? Sugar and simple carbohydrates like refined flours, when they are consumed, they lead to a spike in your blood glucose. And in response to that, your pancreas secretes insulin and pushes that glucose into cells. And that's normal. But let's say your cells are full of glucose because of that bagel maybe you had for breakfast this morning. So when that happens, the cells reject the the glucose, and the glucose remains in the bloodstream longer than it should. And when this happens, your pancreas has to put out more insulin to convert that sugar into fat for storage. But the problem is that the longer your blood remains high in sugar, the more probability that sugar has to bind onto protein molecules. And this has a barbed wire-like effect, coating over the protein. So now you have protein molecules that have covered with barbed wire bouncing off the insides of your arterial walls. And this is just one way that sugar and simple carbohydrates can cause systemic inflammation. Another problem are the bad fats. And notice I say bad fats and not all fats. There's a distinct difference, and we're going to go into that in the program. Bad fats, compared to prehistoric times, which is over here on this graph, our diet now contains about 20 times more omega-6 fatty acids, which are inflammatory, compared to than it did in the Paleolithic times, when they were much higher in the omega-3 fatty acids. And when the balance shifts to an unhealthy level of omega-6 fatty acids, which can be found in all of these oils here, then your cells produce cytokines, which directly cause inflammation, and that inflammation builds up within the bloodstream and it gets delivered to your muscles, joints, and other organ systems. So that's one way that bad fats cause inflammation. And what's interesting here in this graph, you can see that tissue omega-6 content is directly correlates with your risk of dying from heart disease. So here we are, USA, with the highest tissue omega-6 fatty acid content, and yes, we have the highest rate of dying from heart disease. Whereas, interestingly, Greenland, Japan, and the Mediterranean, who all have diets higher in omega-3s because they typically eat more fish than us, have lower rates of dying of heart disease. So, something that's interesting. So the other problem is our own darn fat. Once we become overweight, the subcutaneous and the deep visceral fat is really considered to become its own organ. That's because it's capable of now producing its own pro-inflammatory compounds and hormones like estrogen and leptin, which when it's overproduced, leptin when it's overproduced leads to that turning off of that signal that tells you to stop eating. Research also shows that blood delivery can't keep up with the growth of fat. So now you have these fat cells that are being starved of oxygen, so they release all these pro-inflammatory compounds to try and induce that blood delivery. So in reality, being overweight is a huge red flag that you are at higher risk of all chronic disease. And that's all because of the tremendous effect that our own fat has on your inflammatory status. Okay, and last thing that's contributing to inflammation is toxins. There are over 74 billion pounds of 80,000 different chemicals that are either imported or produced in the United States every single day. And that does not include pesticides, food additives, fuel, or pharmaceutical drugs. Mercury is one of the most toxic substances known to man, and yet it can be found in every single one of us, mostly because of contamination of our food and water. Chlorine, we're all exposed to because it's in our drinking water. And it's been shown to kill off beneficial gut bacteria, which, as we learned, will impact the entire immune system. It also forms compounds within the water with other molecules, and that is what accounts for 93% increase in cancer in those who drink chlorinated water versus those who don't. So, chronic low exposure to toxins, which we all are victims of, is going to hugely impact your risk of getting any chronic disease, and conditions like asthma, eczema, food intolerances and sensitivities all increase the more toxins are found within our environment. So it actually can be argued that any disease process can be caused by or contributed to, complicated by your toxic load. So we can't get away from this stuff. We live in an industrialized society, and you're going to be exposed to it every single day through the food that you eat, the water you drink, the air that you breathe, and the chemicals that you put on your skin. And these toxins have a profoundly inflammatory effect on the body. Because they cause so much damage, they are normally stored in tissues and organs where they will cause the least immediate effect on your overall health. And that typically tends to be your bones and your fat tissue. So this has an important implication for weight loss. So dieting will result in fat loss, but because you didn't do anything to deal with the toxins that are stored in the fat, that actually increases the toxic density of your body. And because your body's solution to pollution is dilution, you're going to put weight back on a lot easier because your body's trying to minimize the harmful effects of all these toxins. So that's why detoxification is such a crucial component of weight loss and overall health. once you deal with the toxic load, your body doesn't have a reason to hold on to the extra weight anymore. Okay, so what about your genes? A lot of people like to just lean on the crutch of having bad genes. So your brother, your sister, your aunt all had heart disease. So you're pretty much thinking that you're going to get heart disease. But that doesn't have to be the case. Certain diseases do have a genetic component to them, but the good news is that it's up to us as to whether those bad genes are expressed or not. Research shows that diets that are high in sugar and bad fats and processed foods lead to the methylation or turning on of genes that are linked to the expression of obesity, cancers, Alzheimer's disease, you name it. And then the exact converse is true. Diets that are high in vegetables and fruits and low in sugar and high in good fats all lead to the prevention of expression of those very same genes. So it turns out to actually matter more the environment that those genes are in. So it can be said that genes may load the gun, but environment pulls the trigger. And leading an anti-inflammatory, healthy lifestyle can help you push off those family history diseases far off into the future or prevent them from happening at all. So what do we do about this epidemic of inflammation and lifestyle-related disease? We currently spend more than any other country on healthcare, and yet we rank 37th in terms of our overall health in our nation. So whatever we're doing isn't working, and something has to change, and unfortunately, Obamacare is not the answer. We kind of missed the boat on the whole reducing healthcare cost thing. But we need a new healthcare paradigm. Today, going to the doctor generally doesn't make you healthier. It makes you sicker because each time you go, you get placed on a new drug. And that new drug has side effects that you're probably going to need another new drug for. But we need to start thinking about health as an individual responsibility. It's up to you to learn how to maintain it and how to protect your body's ability to self-heal as you go through life. And no doctor or treatment or drug or system can do that for you or force you to do it. So we really need to learn to think about healthcare in a completely different way. And I propose a tier system. So the first and most important tier is self-care. This is what you must do for yourself in order to keep your mind, body, and spirit healthy and functioning at its highest level, which nobody else can do for you. Nobody else can go exercise for you. Nobody else can eat healthy for you. It's up to you to be responsible and keep yourself within this tier as often as you can and as best you can. Okay, the next tier down is health care. This is what you must do for yourself to keep your mind and body and spirit still healthy and functioning at its highest level, utilizing the skills of a trained health care specialist. A perfect example of this is in order to keep your body in alignment and your nerves efficiently communicating with the rest of your body, chiropractic care is something that you can utilize to protect your body's ability to still self-heal. As chiropractors, we also are trained in nutrition, much more than medical doctors are, and we are the people that you should turn to for dietary advice and for nutritional testing and counseling. And the last tier is crisis care. So this is what you must do for yourself in order to recover from an injury or illness, utilizing the skills of a crisis care specialist. An example would be if you get in a bad car accident, or if you are having a heart attack, you should probably go to the emergency room, or at least the medical doctor, because that is what they're trained to do. They're really good at crisis care. So this is the whole key to the foundation that's totally different from our current healthcare paradigm, because medical doctors aren't very good at caring for chronic disease. They're not trained in nutrition, and they do not learn in medical school how to keep the body in its optimal state of wellness without the use of crisis care tools like drugs or surgery. So just because your medical doctor thinks you should care for something in a certain way or doesn't think there's a cure for your condition doesn't mean that the knowledge doesn't exist elsewhere. So where people get into trouble is when they ignore these first two crucial steps of self-care and health-care, and they end up at crisis care as their first form of health-care. So someone who's living with thinking that they can ignore these two steps is really going to be in for a rude awakening when that first heart attack they have kills them, despite the fact they were taking their beta blocker and statin drug and daily dose of baby aspirin. So there's really no denying that a healthcare paradigm like this would definitely save Americans billions of dollars, but more importantly, our population would be much happier and much healthier. So let's talk about that most important self-care tier. This is what you can do for yourself right now to get yourself on track utilizing an anti-inflammatory lifestyle. So I decided to bring in 28 Days to Health because when I was in chiropractic school, I was under the assumption, naive assumption, that I could fix everybody's problems with a quick adjustment, and they just come in every now and then for a quick tune-up, and we'd all live in a healthy world where everybody was responsible for their health. But when I started practicing, I was realizing that people's neck and back pain and headaches weren't their main problems. They were suffering from obesity or diabetes or autoimmune disease or thyroid conditions. Kids are taking prescription medications, and adults are taking 3 or more prescription medications, and they still think they're healthy. But the reality is that 5 years down the road, they're going to be in a lot worse health because these are all just signs that their bodies are already deteriorating. So I started to realize that people needed my help not just to stay healthy, but to actually get healthy. And that's why I decided to bring in this program. So this is what we're going to do in the program. We're literally learning to care for ourselves, which a lot of people think they know how to do. But if that were true, then we wouldn't have these problems with chronic disease like we do. So we're going to learn to implement all the facets of an anti-inflammatory lifestyle. Then you're going to learn how to maintain this for the rest of your life. So we do this by learning how to minimize your intake to inflammatory foods and your exposure to common toxins. We maximize your body's natural detox pathways, maintain appropriate hydration levels. You're going to know what that is for you. We're going to prepare nutrient-dense, balanced meals for every single meal. Avoid common criminals in the diet, improve your body's pH, and supplement your body effectively to meet your goals. And for all your effort, you get some pretty big rewards in a very short period of time. These are some of the results that people in my previous classes have experienced. And really, it's all from changing your body's status from an inflammatory state into an anti-inflammatory state. So, dramatic loss of body fat, increased lean muscle mass, improved clarity, improved mood, increased energy, enhanced athletic performance, can reduce allergy symptoms, high blood pressure, high cholesterol, improve intestinal health, eliminate headaches, muscles, and joint pain, which actually is kind of a problem for me because I don't get to see my patients as much. Not really complaining. Improve blood sugar levels and clear up skin. I could also add to the list increased fertility, if that's something you're interested in, because one of my patients who completed the class last time had been trying to get pregnant for a year and got pregnant literally a week after she completed the cleanse. So I can get you pregnant if that's what you want. Okay. So there is objective evidence that shows programs like 28 Days to Health can have some long-term health benefits. I'm currently studying for my diploma in clinical nutrition, and in one of my textbooks I was reading the other day, I found this statement that's absolutely perfect. A hypoallergenic diet, which is what 28 Days to Health is, with a broad spectrum macro and micronutrient drink, which is what the 28 Days to Health products provide, an intake of at least 2 quarts of filtered water per day produced significant improvements in objective measures of intestinal permeability, that's that leaky gut, inflammation of the gut, and hepatic or liver phase 1 and phase 2 detoxification capacity. And if you choose to do the complete cleanse system, those products have also been shown to increase phase 1 and phase 2 detox pathways. So this was found in both people suffering from chronic disease and in asymptomatic individuals or people who don't experience any symptoms. And this conclusion was drawn from 2 independent studies, both published in the Journal of Alternative Therapies in Health and Medicine. So some personal questions for you guys. How old are you versus how old do you feel? So if you feel older than your age or even your age, then you are depriving yourself of a level of quality that you should be experiencing in your life. You should and you can feel younger than your chronological age. And how you feel is greatly determined by your level of energy. So if you're overweight or out of shape, then your body's using up energy just to try and maintain itself. Or if you're sick, suffering from a chronic disease or injury, then your body's just using up energy towards healing itself. So the law of conservation of energy states that energy can't be created or destroyed, but it can be redistributed. So an example is that you feel really tired when you have a cold or the flu, and that's because your body is using up energy towards trying to heal itself. So if you adjust your lifestyle to heal your body, then all that energy that was being used up to either maintain yourself or heal yourself can be freed up and used in ways that you want to use it. So bottom line is, if you knew you were going to live 100 years, wouldn't you take better care of yourself right now? Your body needs to be prepared for all the miles that you are planning to put on it, because otherwise living to 100 or even 90 or even 80 will not be something that you look forward to. And one last thing, one of my favorite quotes, the food that you eat can either be the safest and most powerful form of medicine or the slowest form of poison. And that's something you should think about when you go and have dinner tonight or breakfast tomorrow. And you will be glad to know that all the appetizers were made with foods that are considered to be safe and powerful forms of medicine. And these are the types of foods that are emphasized on the cleanse. So that's it. We're just going to go over some class details. So it's $125 for all 4 classes. That includes the class manual, ebooks for recipes, and a light dinner provided at every class. These are just appetizers. Usually it's more than this. Also, we're going to be meeting a 5th time to do a final weigh-in and a potluck. So plan on that. And Mondays is when they're held for an hour at about 6:15, starting next Monday. We measure body composition, different aspects of body composition, which you have a chance to do tonight if you want. And we assess for change throughout the month. And there are tools available for you. Go ahead and flip on the lights.
No.
Sorry.
Oh.
That's why you close your eyes first.
Oh.
Close your eyes first.
Sorry. So, these tools are available to you to make the program a little easier and more convenient to follow. The program does require that you have nutrient-dense, balanced meals every single meal of the day. And that becomes really hard for people, especially during breakfast, when they just want to run out the door. So typically people make protein shakes for breakfast, and that consists of the protein powder, the fiber, the greens, and sometimes the fish oil, which is over here. And this creates a super nutrient-dense shake that keeps you full for hours. I have mine at 7:30 in the morning, and I don't need to eat lunch until 1 or 2 without a problem. So just even by replacing 1 meal a day with a shake, you're going to feel a lot better than even if you didn't do anything else. And that's because the shake provides 100% RDA of your vitamins and minerals, so it's like a multivitamin, plus the fiber, the antioxidants, probiotics, and omega-3s. So everything your body is missing is supplied in a really easy to make shake. that really costs less than a highly inflammatory breakfast at McDonald's. So it only is $3.50 a shake, I think it comes out to.
And what is that called? What is it?
What?
What is the shake? What is that it there?
This is the protein powder. That is the kind of foundation of the shake, and then I add more fiber. And the greens is the formula contains 13 different dehydrated vegetables and helps to alkalize the body. Mostly we're all acidic because of our diets. We go into more detail about the products next class too, but so the cleanse, sorry, and I meant to explain, usually I do all this tasting afterwards, but because I had another class I had to do it all. The purple drink was the shake, but the shake, it was made with berries and water, and that's because I didn't have almond milk, but I usually put almond milk on mine. It tastes better than it did tonight. And also the greens, the green formula, that was this, the green drink. And then, so the cleanse system comes into play during week 2, and that consists of the cleanse powder, the cleanse capsules, and the Ultra Body Move. And these products help you to efficiently eliminate stored toxins that are causing inflammation and maybe keeping you from losing the weight. And all of these products are gluten-free, soy-free, dairy-free, and GMO-free. And they are the highest quality products of their kind on the market today. Believe me, because I've looked. I had been looking for a system that I could implement to try and help my patients, because I knew it would mean a lot to me to be able to help people in ways that I knew I could, and this program made it really easy for me to do that. And I could never endorse anything or sell anything that I didn't truly 100% believe and know that it worked. And from my past experience in teaching these classes, I know that if you utilize the tools provided, you will maximize your benefits and get the most out of the program. It's just the way it is. So you could do anything for 28 days, usually, and you can choose to do whatever you want to do after that. But I truly know that for all of you, this is a step in the right direction. And if you could change your life in 28 days, why wouldn't you? So that's it for tonight. And Michelle's going to pass around order forms. You can sign up for the class and choose to get any product that you want. If you have any questions about what the kits are, come up here because I have them all laid out. I have some testimonials from the past class too. You want to check it out. Any questions?
Oh, that is excellent.
Are you using alkaline water or filtered water?
For the recommendations in water here today, filtered water.
We can put both yours
Yeah,
on there.
preferably